We feel as though Geisinger is making decisions without thinking of their staff that makes the hospital able to run. We feel as though you are making decisions only based on your gain. All of us here stand united and unionized as Geisinger's forgotten few. I can honestly say everyone here with me today feels as though we are undervalued in the Geisinger system, even though the hospital cannot function without us. We are what makes Geisinger able to do what they do. We are aiming to have the negotiations bring us to your attention and make it known that we are here, we exist, and we want to be treated as fairly and decently as we are told we are. We stand here united to prove we will not just take the back seat and let Geisinger keep making decisions for us that only benefit them. The operating room is a vast collection of all types of people. Although everyone isn't the same as the next, we all stand for the same thing, treating each patient as if they were our own family member. We see different surgeries day in and day out. We all need to be proficient in all surgeries, from podiatry to neurosurgery. Surgeons count on us to be there, be present, and be ready for whatever is to come. We go into every case with a hope for the best and prepare for the worst mentality. We need to be ready for anything that can happen in that case. We hope to achieve recognition for who we are, what we do, and what we stand for. We also want to educate everyone about what a surgical technologist is, because we are the forgotten few. We are specially trained for the operating room, sterility, and instrumentation. We hope to be recognized for how important we are to the operating team. I want negotiations to be fair and respectful. All surgical technologists are 100% united in these negotiations, and I want to thank all of them for everything they have done to work towards becoming united. Thank you.
My name is Joanne Kobush. I work in the CAT scan department at GWV. I'm only there a little over a year, but I have to tell you that I love my job immensely. I love everybody that I work with. And I want to thank you for the opportunity to communicate our concerns with you today. We are looking forward to working with you and developing a great environment. The selling of Geisinger to Kaiser was a very big part of why my coworkers and I are very concerned about the future of Geisinger as an entity. Talking to my coworkers, we are concerned about the stability of our jobs and a safe environment to work in. It is our intention to bargain in good faith for a fair contract for the union employees and the employer, Geisinger. Thank you again, and we look forward to negotiating. Together we can unite for a fair and reasonable contract.
Good morning. My name is Janine Oliveri. I've been employed at Geisinger since 1992 in the ultrasound department. I've worked at GWV as well as several Geisinger clinics, and now I'm at Geisinger South Wilkes-Barre. I've worked in various roles, including ultrasound chief tech, technical director of the vascular lab, preceptor, staff sonographer, and vascular technologist. After 31 years with Geisinger, I never ever thought I would be sitting here across from management, involved with a bargaining committee, a union. So close to retirement, did I even really want to be involved? I have only a few more years, and I felt maybe I could just write it out. But with talk of the acquisition, I began to silently question, am I secure here? Is there any job protection? I also wondered, if I didn't get involved with this committee, who would bring years of knowledge and history when representing the ultrasound and vascular team? So I am here because I have that history, and I truly care about my coworkers and my department, and I believe all employees should be treated fairly. After becoming involved with the bargaining unit, I realized how truly unfair many employees are being treated. The depth of inequality is disappointing. Something is wrong when employees with excellent skills and years of loyalty are let go, and those with the ability to do half the job are paid the most in the department. I know it can be better than this because it was better than this. I remember when there was a sense of camaraderie between management and employees. Employees felt valued, respected, and were praised for their contributions and expertise. We were treated like people and not assets. Employees should feel excited to come to work. They should feel valued, lifted up and encouraged, able to strive for advancement. and those who are qualified should really have a fair shot at it. Over the years, Geisinger has grown and achieved great success. It maintains a 5-star hospital rating, trauma center, holds magnet status, world-class heart hospital, world-class vascular services, and many fully accredited labs. None of these achievements would be possible if it wasn't for the dedicated, hardworking, and loyal workforce. It is time the employees are rewarded and valued for their critical role in helping Geisinger maintain its esteemed reputation. I remain hopeful and optimistic that this process will result in a transparent and favorable outcome for all involved. Thank you for your time.
Good day, I'm Tracy. I've worked in mammography for 24 years. I've been at Geisinger for about 20 years, and I do about 100 patients a week. I perform breast biopsies. I'm responsible for the quality control of all the machines when we have MQSA, so we can get inspected and pass. The productivity at the women's imaging department at GWV is extremely high. We are pushed to do patients with no added staff. We keep increasing our productivity while maintaining a 99 percentile for patient satisfaction for at least the last 5 years. I decided to unite with my coworkers to form a union because each year I see more and more benefits taken away from us. Management ignores my department's needs and shows no effort to improve. So I'm here today to keep what I worked for and get what I deserve. Thank you.
Good morning, everybody. My name is Amy Lynn Price. I am a medical lab technician at Geisinger, Wyoming Valley. Becoming a medical lab tech was actually a dream for me. I started as a nursing major, took microbiology, and fell in love. Joining the lab was the best thing that I've ever done. This lab is one of the best I've ever seen with the best coworkers. I joined the union because I wanted to see everyone in the entire hospital, not just the lab, be treated with equality and fairness. I'm hoping in negotiations will bring us a side that everyone can agree on, so we are all given the credit that we deserve. So all parties are treated with respect and dignity and make this health system the best in this valley. Thank you for your time.
Hi, my name is Samantha Price. I'm currently employed at Geisinger as an emergency room technician 1, and I'm going to school to become a nurse. I've been in this position for a little over a year and a half, but before this, I spent 6 years as an aerospace medical technician in the United States Air Force. I think I can speak for most of us here when I say the reason I chose a career in healthcare is to help people in some way. For me, personally, it's all about the patient care and ensuring that they're receiving the best care that I can provide during a 12-hour shift. That ranges from an infant who's had a fever for a week that can't come down to a 95-year-old who fell and broke their hip. When I first moved to Pennsylvania, I worked at UPMC, and I heard about what a great company Geisinger is. I was told to work for Geisinger because they actually care about their employees and they treat them like family. The employees are not just a number or a body, that they actually matter and are taken care of. This is one of the reasons why I came to Geisinger. In the past year, I've learned that's no longer accurate. We are treated as if we don't matter, yet in the same breath, we are asked to do more with less staff and the same pay. Our management will change policies at a whim and expect us to sign that we agree. Since this has happened, the turnover rate has increased. There's a rise in burnout amongst our coworkers, animosity between workers and management, and all of this bleeds over into our patient care. We as workers are not the only ones who are suffering from this, and our patients are suffering as well, and it's unfair to them. Geisinger used to be a great place to work and to be treated. Now us workers are doing our best to come together with you to get Geisinger back to where it was. We are workers who want to be heard, respected, valued, and treated fairly, and most importantly, like human beings. And we want our patients to receive the best care that they deserve. We deserve to have a voice and to be able to say, we deserve better staffing ratios. With your help in this negotiation process, we will be able to attain this. Thank you.
My name is Cindy Wagner. I've been at Geisinger, Wyoming Valley for 40 years next month. I'm here with my fellow respiratory therapists representing our department in these union negotiations. I've seen a lot of change over the last 40 years, some good and some not so good. We feel that a union contract is needed at this time to protect our department with the future of our hospital and the joint venture with Rising Kaiser Permanente. We hope to improve communications with management and the patient outcome with improved safety measures and happier employees.
Again, my name is Robert Almedina, labor and delivery. Geisinger employed for a little over 8 years. I became a nurse at first because it was a secure field. I fell in love with what I do because I generally enjoy working with people, more recently mom and babies. Coming to work, I know every day keeps me on my toes. The LPN scrub type roles and NOB is a unique role where because of the RN shortage, I have been trained to work as a nursery nurse, taking care of and assisting in resuscitation of newborns, as a surgical technologist where I assist the surgeons in C-sections and emergencies. And lastly, mom and baby, where I care for moms and their newborns. I attend in-services, receive certifications, and go to all sorts of training to stay on the top of my game, along with my coworkers. The last few years, since I've been with Geisinger, I've noticed an increase in policy changes that benefit Geisinger, but not its employees. I've seen benefits taken away. I've noticed a push for everyone to work at the top of their license, and I've noticed employees, such as myself, being used in more than one role to fill the roles that Geisinger cannot do, without being compensated properly. It is difficult to keep up with our departments, what our departments wants. When we are being pushed and pulled in many directions. I, for one, do multiple jobs. I know Geisinger has a lot of decisions to make, but it'd be great to be included in decisions regarding us, the employees. There's surveys put out and questionnaires, but the reality of it is we don't think what we say really has an impact. Examples are our benefits. I've seen multiple benefit packages since I started. Some are good, some are not. This recent one has employees paying co-pays all over. Labs, x-rays, doctor visits. If I go to an urgent care because my Geisinger family doctor is never available, I go from paying $10 to $90, depending on the services. For a company that has its name on the insurance, I'm not expecting it to be free, but more reasonable for our employees. I feel for our employees who avoid going because they can't afford all the co-pays. I decided to join with my coworkers to form a union to see a change made for us as a whole. From the way we are treated by management, for management being held accountable for their actions, to increases in wages for all the work we do, and bettering our work lives in general so that we may continue to give the best care to our patients here at Geisinger. I know coming to the table here and demanding things change, demanding more money, demanding things in general isn't going to be easy. So I come to this table to sit and voice my concerns, discuss changes that I believe should be made in efforts to keep your employees and making a great work environment for our Geisinger employees. And continue giving our best care for our Geisinger patients. Again, my name is Robert, and I represent my team on OB.
Hi, I'm Jackie. I currently work in the endoscopy department at GWV. I have been with Geisinger for almost 11 years. For as long as I can remember, I've always wanted to be a nurse. I am very passionate about my job and taking care of others, but it has been challenging recently due to the inability to retain staff. Many have left the system due to what competitors are offering as far as benefits, PTO, and wages. We have also lost many wonderful nurses and staff because of the pandemic. Some were forced into retirement and others have chosen to leave, and it has definitely left many areas short-staffed. I myself had to make the difficult choice of leaving a full-time position for a per diem job because of not having enough PTO to cover my high-risk pregnancy care and maternity leave. And since I have left, Geisinger has chosen to eliminate more PTO time. These choices made by Geisinger are the reasons employees are choosing to leave the system. I stand by my coworkers in forming a union for this reason. I understand going forward that not everything will go the way that everyone wants, nor will it be easy. I have been in the nursing field for over 20 years, and the last 5 have been the toughest. With all the changes to healthcare systems and COVID, as I said, staffing and staff retention seem to have taken the biggest hit, and it is absolutely affecting patient safety and care, which is why we are all here.